are the most common biomarkers associated with ovarian cancer?
The most common biomarkers, first of all, are the genetic mutations that are associated with higher risk. So many folks are familiar with BRCA1 and BRCA2. There's a couple of lesser known genetic mutations that fall into that family that also can put patients at an inherited risk. Other biomarker testing that we do is for something called HRD, which is a test to look at a profile of the cancer that is similar to having the BRCA1 and BRCA2 mutations. It's a spectrum of different testing that may make those cancers more susceptible to PARP inhibitor therapy.
Are there biomarkers associated with prognosis?
Yes. So in patients who have BRCA1 or BRCA2 mutations, that they actually tend to have better prognosis longer term and better responsiveness to chemotherapy and other therapies. Patients who also have HRD may also have a little improved responsiveness to some of the therapies as well.
How do these biomarkers impact ovarian cancer treatment options?
Yeah, good question. So the biomarker testing, again, particularly for the BRCA1, BRCA2, and then the HRD spectrum, there's been several very large studies that have looked at using a variety of drugs that fall under this group called PARP inhibitors, PARP inhibitors. And these drugs specifically target cancers that have these mutations or more susceptible to these mutations. And interestingly, have found that when we use these PARP inhibitors in a maintenance therapy, so after patients have completed their primary treatment, surgery, chemotherapy, and then go on a maintenance therapy to prevent recurrence, they have very, very long improvement in survival and pushing out recurrence very far, significantly so, more than we've seen kind of for anything in ovarian cancer in recent years. So it's very, very exciting.
What questions should patients ask about test results?
Yeah, it's interesting now because as many patients have experienced, they sometimes get their test results before their provider has had a chance to review them as part of the patient access program that's been in place. So I find that many patients have had time to kind of sit with their results or question or go on the internet about them before they see me. So some of it is kind of helping direct, okay, where are you getting your information from and all of that, because I think that is something newer now. But, I think it's important for patients to be asking, do I, do I qualify for genetic testing and what are those results? What are the implications for myself and or my family members? And then the molecular testing, as I said, is a very important next step that we do recommend for kind of all certainly advanced ovarian cancers or recurrent ovarian cancers to help better guide therapy.